Okay, good afternoon, boa tarde a todos. Hello, Dr. Keith, Martin, good afternoon. It's a pleasure to welcome you to this event. I am Marcelle Miranda, professor at the Federal University of Rio de Janeiro. We greatly appreciate her participation here. Please allow to introduce you to our audience in Portuguese, okay? Bom, gente, boa tarde, né? O Dr. Keith Martin, é médico que desde setembro de 2012 atua como diretor executivo fundador do Consórcio de Universidades para a Saúde Global. Entre 1993 e 2011, o Dr. Martin foi membro do Parlamento na Câmara dos Comuns do Canadá, Canadian House of Commons, né? Só para esclarecer, a Câmara dos Comuns do Canadá é uma parte do Parlamento do Canadá, que também inclui o chefe de Estado do Canadá e pelo Senado. O Dr. Keith ocupou carteiras nas áreas de relações exteriores, saúde, meio ambiente, defesa e desenvolvimento internacional. Ele esteve em muitas missões diplomáticas em áreas em crise ao redor do mundo, mas particularmente em toda a África, e trabalhou como médico na fronteira com Moçambique durante a Guerra Civil. Ele passou muitos anos como voluntário em esforços de conservação na África do Sul e é membro do Queen's Private Council for Canada, né, Conselho Privado da Rainha para o Canadá. Né, o Conselho Privado, ele também é conhecido como Conselho Privado de Sua Majestade, e é uma instituição canadense criada pela Constituição do Canadá que desempenha um papel simbólico no governo do país. Então, temos um palestrante de peso que vos fala de um importante lugar, né, diretor executivo do Consórcio de Universidades para a Saúde Global. Cabe salientar que esse consórcio é uma organização com sede em Washington, D.C., em rápido crescimento, composta por mais de 170 instituições acadêmicas e outras organizações de todo o mundo, empenhadas em enfrentar os desafios da saúde global. O consórcio ele foi estabelecido em 2008 com o financiamento generoso da Fundação Bill e Melinda Gates e da Fundação Rockefeller. Then Dr. Keith, a strong curriculum in the field of acting. We will not have simultaneous translation of your speech. And so I ask you, please speak slowly so that the audience can better understand you, include me, of course. We will have 30 minutes to speak, and then we'll open for the same time for discussion. And now, Dr. Keith, thank you again. You have the word.
Obrigado, Professor de Silva, and welcome everybody. It is really an honor for me to join you today, and to know where I am. I'm about 1 kilometer north of the White House in Washington, D.C. So when the leadership of the conference invited me to speak, they really wanted to know about how we could explore what academia could do to improve the lives and welfare of people. And so what I want to do with you and Professor de Silva is that we are going to explore what some of the challenges and opportunities exist to improve people's well-being, and what academia can do to contribute to that effort. And I think what we'll see is there's a lot we can do. So Hannah is going to advance my slides, and Hannah, and first, I apologize for my inability to speak Portuguese. One day I will learn. Hannah, next slide, please.
Yes, Hannah, por favor, isso, a visualização, modo tela cheia. E pode passar o próximo slide que ele já pediu, por favor. Obrigada.
Obrigado. So the question is academia fit for purpose? If it is, we don't need to go much further. But if it isn't, how could we reform the institution and again, a central question is, how can academia play a bigger role in addressing and improving the well-being of people? Next slide, please. So we're going to look at this first about what some of the challenges are, because we need to look at this in the context, of course, of contemporary challenges. So you can see from the slide, what you know is that we have old challenges, infectious diseases, non-communicable diseases. We have environmental challenges. We also have new challenges, as we've seen from the COVID-19 pandemic, worsening climate change, the biodiversity crisis that you see in graphically in the Amazon basin and around the world. And then we've got other political challenges that are overlying all of that. And I think it would be fair to say that democracy is becoming weaker around the world, and this is contributing to increasing state instability. You're seeing that around the world and very close to home, both in Portugal as well as in Brazil. Next slide, Hannah. So what are the targets? Well, we have targets. We have the Sustainable Development Goals, 17 goals, 169 targets. Agreed to in 2015. The endpoint is 2030. So how are we doing? How far have we gone to achieve these goals that we all agreed to achieve in the next 9 years? Well, I think you'll see we have not come very far. Next slide, please, Hannah. Let's look at 3 contemporary examples. We just saw in the top right-hand corner, you can see the Amazon basin and the destruction. I think all of us saw the negotiations in Glasgow at the COP26 meeting. But what came out of that is, of course, less than desirable. If you ask the question, where are we today in dealing with climate change? The truth is that we're only at 25% of the commitments needed to reduce greenhouse gases by 50% by 2030. Why is that important? Because that's the target that we need to achieve to be able to keep global warming below 1.5 degrees Celsius. Above that, the troubles we are seeing around the world are going to get much, much worse. So we're not even at the level of the commitments needed to be able to achieve those. And we only have 9 years to achieve them. So we're far behind. And what came out of the COP26 is always an agreement of the lowest common denominator, because all of the 193 countries that are there, they have to agree to the end product. So you're looking at the lowest common denominator. Second, those agreements that people make, those countries that they make, those agreements are not obligatory, they're voluntary. So it's too easy to not actually achieve them. And that's what we're seeing over and over and over again. Another example, on the left, those beautiful parrots, which are deeply endangered in South America. This is the biodiversity crisis that we're seeing. Back in 2010, the world got together and said, the loss of biodiversity, and 1 out of 8 species are going to go extinct, is really a critical issue for our well-being. Because what's happening is the network of species in the world is being torn apart. Why that's important for us is that we know that we rely upon our food, livelihoods, and much more if we have intact ecosystems and we're not destroying the species in front of us. So this is a neglected crisis. And in fact, I would argue that this biodiversity crisis is even more significant than the climate change crisis, because extinction is forever. So as species are being wiped out, our ability to feed ourselves and have livelihoods is being severely destroyed. So the world got together in 2010 in Japan and said, we need to develop some targets. And they did. 20 targets were developed. So they came back in 2020 and they asked themselves, well, how far have we gone in achieving those 20 targets? Guess how many we achieved? None. not one of those targets were achieved. Final example, you can see on the bottom, the COVID-19 pandemic we're seeing now. You remember the Ebola outbreak in West Africa back in 2014? And the world said, oh, we have to do something about this. We're not prepared to prevent, detect, or respond to a pandemic. So we got together, the world, and 93 countries and groups came together and developed something called the Global Health Security Agenda. I would check it out. That was created because we knew that pandemics are a normal part of life and they're going to happen again. Well, disease outbreaks are going to happen. Pandemics are not necessarily a given because you can prevent them. What did we see when the COVID-19 outbreak took place? Sorry, the SARS-CoV-2 outbreak started, that we were incredibly ill prepared to prevent, detect, and respond once again to a disease outbreak, despite all of the agreements we have made. So we're seeing it play out now. Here in the United States, 800,000 people have died of COVID-19, the largest number in the world. Now, this is the richest country in the world that spends 50% more on health than any other country in the world, and yet has the highest death rate from this preventable virus. So we've seen we're not prepared on climate change, we're not prepared on biodiversity crisis, and we're not prepared to deal with the pandemic crisis. 3 crises we've proven over the recent past that we're not winning, we're failing. Next slide, please, Hannah. So let's look at what actually makes up the people's well-being. I was on a call, in fact, this morning with leaders from another part of the world, and they were talking about improving people's well-being, and they were talking from low-income countries, and they were discussing primarily about what's in the top right-hand corner, healthcare. Now, you can see from this slide that healthy people sit on the top of a pyramid. But what really is important in terms of the foundation of people's well-being is, in part, can you get care in the health system, which is very important. But having a healthy society and having healthy people is dependent on a whole lot more. And you can see from this graph that you need a healthy society, you need a healthy environment, a healthy community, and that's got to do with things like, do you have access to water and food? Do you live in a safe environment? Do you have are your human rights abused? Do you live in a polluted environment? Can you get a job? Do you have enough money? Can you get a good education? All of those things you and I know are really important to people's well-being. But we tend to focus on development and in global health. Up in that one corner, healthcare. But I'm going to argue that we're missing a really important piece. We're missing the foundation of development that you can see on the bottom that supports all of us as human beings on the top. And here's our challenge. We've got to be able to start focusing our efforts on the foundation of people's well-being. And that not only includes people's health care, but all those other things I mentioned. So let's explore this a little bit better. Next slide, please, Hannah. The other part of those determinants of health, those social determinants of health that we forget about, are the political determinants of health. Do you have a government? Are you a citizen of a country where your government is democratic? Do they answer to the people? Do you have strong public institutions? Do you have a fair and equitable justice system that protects people's human rights? Do you have a free press? Do you have rule of law? These things are utterly neglected, in my experience, in development and global health. And yet they're fundamental to people's well-being. And you can look at contemporary examples close to home. In Portugal, just look south of where you are. Look at what's happening in Nigeria, up in where there's major instability in Nigeria and across the Sahel. None of those countries have really strong, effective governance systems. They have significant problems with their politics, and all of those issues that I mentioned are often being undermined within those countries. Look at Yemen, look at Syria, look at closer to home in Yugoslavia, where in Yugoslavia, a storm is brewing in the former Yugoslavia, which could blow up into a significant conflict at the heart of Europe. These issues that are happening can explode the health and welfare of people, drive the health of people and their well-being down more rapidly than anything else. It's important to know that on those challenges I mentioned, whether it's the pandemic, climate change, biodiversity crisis, whether we know how to address these challenges, but whether we are or are not addressing them is a matter of political choice. And political choices are being made that are actually hurting people's well-being. Next slide, please. Thank you, Hannah. To put another way, this is a diagram I created. I call it the neglected foundation of development. You probably see that when we talk about achieving the Sustainable Development Goals, we focus at the top of the pyramid. But in order to achieve those, whether you're trying to get access to good education systems, healthcare systems, access to potable water, access to a strong and healthy environment, where the human rights are protected, you've got to have strong public institutions that underpin that. And those have to be have independent oversight mechanisms, and you have to have other pillars of a strong, stable nation, such as a free press, and you have to have independent oversight of elections. These sound like dull things, but I would argue that if you take a look at any of the countries right now that are being mired in poverty for generations, or are countries of instability, and I mentioned Syria, Yemen, Ethiopia right now, you can look at or the ability to respond to crises such as in South Sudan, where they have many serious problems. Governance, the bottom part of that pyramid is critically important for our ability to achieve the Sustainable Development Goals. Critically important to have a healthcare system. Think of it this way. Let's an example. We do a lot of work in enabling people to access safe and affordable surgery. Why that's important is that, of course, you look at the non-communicable diseases, whether it's cancer, diabetes, heart disease, you've got to have a trauma, you've got to have a surgical system. But what's happened historically in meetings is that they bring together all the wonderful surgeons in the world to discuss how to do that. But if you were the best surgeon in the world and you go into an operating room, how are you going to operate if you don't have a nurse or nurses to help you? If you don't have power, your electricity is off, you don't have the medical supplies you need, you don't have clean water, and your patient doesn't have a way to get to your hospital to get care. What happens is that the best surgeon in the world cannot do what he or she can do to save a person's life if all those other things are not in place. So what I'm saying is we have to, and all of those things are predicated on having a foundation of development that has nothing to do with actually having a really wonderful, competent surgeon at the head of that table. It's got to do with other things. So we have to look at these other things to improve people's well-being. Next slide, please, Hannah. The consequences of not having that foundation are significant. You've got weak public institutions, poor governance. There's been a rise of autocracies around the world that are devastating for human well-being. And this is an important point. In the conversation I was having with health leaders around the world earlier today, the issue of who pays for development, of course, always comes up. And then it often dwells on the issue of official development assistance, which is about $145 billion a year. But the amount of money that's lost through corruption, much of it's stolen from low and middle income countries that are deposited in high income countries, is through corruption. And that's about $1.5 trillion. That's right, $1.5 trillion every single year, according to the International Monetary Fund. So if you look at who pays or how to get money, you've got official development assistance is only 1/10 of the amount that's lost every year to the corruption. Second, that money that belongs to low and middle income countries is sitting in high income countries and tax havens around the world. When poorer countries try to get that money back, guess what happens? It's very difficult to get that money back. High income countries are not giving it back. This is a crime. It needs to be returned. It does not belong to them. It belongs to low and middle income countries. So this is something we need to work on to be able to do that. And then finally, you can see that the inability to have strong public institutions that can deliver the public goods citizens need leads to deep disparities, instability, mass migration, which you're seeing in Europe from countries that have fallen apart and become failed states, human rights abuses. So we need to shift our thinking a little bit in terms of looking at that foundation that I mentioned early on in terms of development and achieving those social determinants of health. Next slide, please, Hannah. So what are our opportunities? As I mentioned, what can academia, what can we do better to be able to contribute to this? Well, we have to be focused. Our assets in academia are a few, but education and training is number one. So what we can do is we can do a better job of using the interdisciplinary training that's necessary to deal with the problems at hand. Teach technical skills too. What we found is that a lot of students, at least in our membership, they have wonderful skills in some ways, but the technical skills may be lagging. So academic institutions that provide those technical skills, project management, finance, leadership, statistics, monitoring and evaluation, those are important skill sets to have. Second, it's really interesting. You can create for senior students ways for them to have experiential learning and provide care and service to low resource communities. I'll give you an example. I was speaking at a meeting of veterinarians because we do a lot of work in One Health. And I was passing by the posters and I saw a dental student actually, at a veterinarian conference. And I stopped and I said, well, what are you doing here? What's your poster about? This is what it was. This university brought together senior dental students and senior veterinary students together to go and provide care in low-income communities in Texas, it was the United States. So these communities would never get dental care, but what the entry point was is they had pets. So the vet students would go in and provide supervised care for people's pets. The dental students would come along and they'd be providing veterinary care for people's pets, but public oral health care for people who would never get access to that. The students got real world training, supervised, safe, and the community got services that they would never have. Now you can imagine that you can combine all manner of skills, nurses, doctors in training, veterinarians, dentists, lawyers to provide legal services. You're only limited by your imagination. How you bring those together is a great opportunity in training and also service. Research, aligning with the public needs. A lot of research is not aligned with public needs and goods, and we need to provide opportunities to change that. So funders need to be able to incentivize research that aligns with the public needs. Also, we produce a mountain of research. I think one of the heartbreaking things personally is to see so much good research go into a journal and stay in a journal. And as a colleague of mine said once, getting published is not the end. It's not the beginning of the end. It's the end of the beginning. So we need to do a better job of incentivizing the translation of the research that's produced into public policy. And that gets me to the last point on the slide, is that we need to do a better job of engaging policymakers to be able to share with them what they can do and work with them to ensure that your great research is going to be used by policymakers and implemented at different levels of government. This is a great opportunity, and I believe that academia has not done a good job in the three areas that I mentioned, and we can do a better job. And in that are a lot of opportunities. Next slide, please, Hannah. So we have to build partnerships, equitable partnerships amongst ourselves. And at our organization, at the Consortium of Universities for Global Health, we're doing a lot of work on outlining what equitable partnerships look like. These partnerships that have to primarily benefit low and low middle income partners first. And we put together, which I'm happy to share with you you can see it on our website at CUGH.org. What are some of the guidelines that we've established that institutions can follow to have equitable partnerships, but build partnerships not only with academic institutions, but build them with governments at different levels. Become partners with them to help them do the research they cannot do alone, to help to strengthen their own training capabilities so they have a stronger workforce in all of the ministries I mentioned that are important to improving people's well-being. And make partnerships with industry too. We're not going to achieve the climate change targets we want without partnering with industry to be able to do that. And that's where we have to be creative and innovative about doing that. Next slide, please, Hannah. So opportunities with our organization, we have, as I said, 182 academic institutions around the world at CUGH. We have a conference coming up in March like yours. It's all virtual. We hope you will attend. You can actually submit a satellite session for the conference before January the 7th. So please go on our website, cugh2021.org, to be able to see what may be of interest in terms of registering for the conference, as well as developing a session that you can still put into the conference. And we hope that this works, because a lot of our members, as you'll appreciate, are Anglophone. And what we're trying to do is pull down the obstacles between Anglophone institutions and Lusophone institutions, Francophone institutions, Spanish-speaking institutions, Arabic-speaking institutions, and others. So we need your help to be able to bridge the gap between Lusophone nations and the global health community. And we would love to work with you on that. And of course, on a number of the other areas that I mentioned, whether it's climate change, biodiversity crisis, pandemic prevention, advocacy. Let us know. Join us. Join CUGH. We'd love to have you as a member, and work with us in our growing family of institutions around the world. But helping us bridge the gap between Lusophone nations would be very, very helpful. And we can showcase we'd love to showcase the work from Lusophone nations to the rest of the world, and vice versa, and build new partnerships. Next slide, please, Hannah. So as I mentioned, this is obviously a destroyed part of the Amazon basin. We're doing a lot of work with UN agencies in the space, and we'd love to work with you on addressing this, because this does not have to be so. And this is important. In this case, this is Amazonia, affecting so many countries in South America. But these are one of the two lungs of the planet, so it affects everybody. And we'd love to be able to work with partners in Brazil and in other countries in South America to address this crisis, if we're welcome to. Next slide, please, Hannah. So you can see that we put health in the middle, but those social determinants of health around health actually impact the well-being of people, and all of those other sustainable development goals affect human well-being. Next slide, please, Hannah. So that's our conference again, CUGH2021.org, Healthy People, Healthy Planet, Social Justice, which fits very well to your conference today. And we certainly hope that you join us and our lead partners from around the world, AfriHealth, an African consortium of 40 institutions, BRAC University in Bangladesh, Stanford and the University of Southern California are partners in this effort. Next slide, please. So we can't do this alone. We have to do this together. As I said before, I'm actually really honored to be with you today as part of this conference. I look forward to having the next conversation with Professor De Silva and you, because I'd like to hear from you how we can partner with you to be able to improve the well-being of people in your own communities and around the world. We can't do this as individuals, but we can definitely have an impact together. And through effective partnerships, we look forward to doing that. So see that we at CUGH are a friend, and we look forward to your guidance and collaboration. Obrigado, and thank you very much. I would just want to say this slide is important because I'll use it often. The program Bolsa Familia in Brazil was so effective at improving the well-being of people who are living in low-income communities. I often showcase that example from Brazil around the world as to what a really effective program can do to help people elevate themselves out of poverty. And these was one of many examples from Lusophone nations that we would like to share around the world and learn from you. So, obrigado. And thank you for your attention. And back to you, Professor De Silva.
Thank you very much, Dr. Keith. It was a great presentation about an important topic for all in the world. Let's start now our discussion here. Hannah, por favor, eu não sei se a plateia já começou a deixar algum comentário ou alguma questão no chat, mas fiquem à vontade para isso. Se não tivermos, Hannah, eu vou fazer uma breve síntese sobre a fala aqui do Dr. Keith, só me avise, por favor. Ok, tá. And so, Dr. Keith, I will do a summary about your speaker, and while the audience maybe show us any questions, okay? While you wait for questions, I will speak a little bit about your presentation in Portuguese, ok? Então, só para fazer uma pequena síntese, né, do que o Dr. Keith nos trouxe sobre esse assunto de interesse global, né? Logo no início, ele disse que quando ele foi convidado a participar desse evento, a pergunta principal que guiou essa apresentação foi o que a academia pode fazer para o bem-estar das pessoas, né? Então, ele trouxe uma série de questões, né, de desafios contemporâneos relacionados aos contextos, quando a gente pensa no âmbito de uma saúde global, né, e muitas coisas relacionadas à própria situação da pandemia, da Covid-19, mas trazendo também outras questões como queimadas, enchentes, seca, pobreza, né, a dualidade das doenças crônicas e de doenças não transmissíveis, né, trazendo aqui muitos exemplos relacionados à queimada na Amazônia, por exemplo, né, as mudanças climáticas, o aquecimento global, enfim. Então, ele avança, né, numa perspectiva de questionar, né, se o que estamos fazendo, né, é correspondente aos objetivos, né, do desenvolvimento sustentável, né? E existem ainda muitas questões, né? Todos os objetivos ainda em aberto com relação ao que precisa ser feito, né, para o alcance desses objetivos. E aí ele traz ali o exemplo, né, dos Estados Unidos, do impacto da pandemia, com 800 mil pessoas, né, que morreram por conta, né, da contaminação pela Covid, e que enfatiza, né, que não estamos preparados para pandemias e para o aquecimento global, por exemplo. Bom, há uma grande relação com a questão da política, né, de países, principalmente o de baixa e média condição socioeconômica, traz alguns exemplos de países africanos, né, e quais são os aspectos que são importantes para que se alcance, né, os determinantes sociais de saúde. Né, e aí principalmente relacionado a uma política favorável, né, que proteja os direitos humanos, que seja livre, transparente, democrática, né, que tenha uma mídia, né, também aberta. E coloca, né, também como em alguns países a falta dessa política favorável, né, a falta de um contexto favorável, como não ter enfermeira, não ter pessoal, não ter recursos humanos, né, não ter poder, não ter água limpa. Então, são questões cruciais para que os profissionais, de uma maneira geral, consigam trabalhar para, né, ir ao encontro da saúde dessa população. E destaca também, né, a própria condição, né, de não se ter uma fundação para o desenvolvimento, né, dos objetivos para o alcance do desenvolvimento sustentável. Bom, e aí no final ele coloca, né, quais são, então, volta para a pergunta das oportunidades da academia, né, e traz ali destaques, né, a questão da educação, da pesquisa e da importância de se construir pontes, né, entre a política, né, e o próprio contexto da academia, para diminuir esses gaps, né, da política que impacta, né, negativo ou positivamente, né, para o alcance dos objetivos do desenvolvimento sustentável. Bom, nenhuma questão ainda, Hannah? Vou seguindo, já finalizando aqui essa síntese, né? Então, um destaque importante, né, é que o conhecimento produzido na academia ele precisa chegar na sociedade, né? E aí ele destaca a translação, né, a transferência de conhecimento para a sociedade e que a publicação de um artigo não é o final, é apenas o início do que a gente precisa fazer, né, para que a gente de fato mude essa realidade. Dr. Keith, I tried to do for the audience a summary of your speaker. I have one question here. Let me try to translate it for you. Just a moment. During the middle of last century, the discussion of human development was closely linked to the fertility control. Nowadays, what are the factors that are closely related to women development?
Obrigado, excellent question. So, as a man answering that question, there are many factors. There are human rights-based issues that women are not treated the same or equally in many countries, and the inability for them to have equality and rights under the law have significant implications for their ability to earn money, to be able to be the masters of their lives. And that also includes access to reproductive health. Every woman, as every man, needs to be able to control their own bodies. And right now, in some countries, in this country here where I sit in the United States, there is a major assault on a woman's right to be able to control her body, to have free and open access to reproductive rights, including contraception and safe, effective abortions. All of those are being undermined. The protection of women's lives, access to education, their rights to be able to own property, their rights under the law. Unless women have the same rights as men across the board, women's health is not going to achieve the same health as men's. And of course, that's a fundamental challenge in development that needs to be addressed, and all of us must put our backs into that.
Okay, thank you. Who asked was Hannah, okay?
I would say one thing, if I may add one thing. Interestingly enough, on the population side, 220 million women around the world would like to have access to contraception, but they cannot access it. So that's a very easy development opportunity, that just enabling women to have access to safe, effective contraception can dramatically increase their ability to have better lives. And also ensuring that every girl has the same access to quality education as every boy.
Ok. Então, Hannah, ainda é um problema, né, a questão da saúde da mulher, do acesso à educação, do acesso aos métodos contraceptivos, para que as mulheres tenham, né, o controle do seu próprio corpo, da sua vida, né, então ainda temos esse grande desafio. I have one question here. Okay, it's another question. Anselmo Cordeiro. How you Hannah, pode me ajudar no sentido de colocar a pergunta no chat privado, por favor? Enquanto isso, eu vou perguntar aqui fazer uma outra pergunta. I have one question here, Dr. Keith. Just a moment. Considering the pandemic, which has further increased discrepancy between countries and affect several other areas related to sustainable development, such as economy and politics, mental health. How has the university consortium been organized in this regard? What have been the priority areas? And the main object and the goals were brought back since the pandemic, because the pandemic froze some activities in health itself, in the management of chronic disease, for example, and how does this impact future actions and thinking about in the pandemic around the world?
Obrigado. Thank you for your question. Thank you, Professor De Silva. So the pandemic has actually driven hundreds of millions of people into extreme poverty, and it has undone decades of advancements in development. I think we know that. So what we've done at CUGH is really try to deal with a number of acute issues. The first, of course, is access to vaccines. And right now, the United States, which holds the patents for important mRNA vaccines from Pfizer and Moderna, we have been pushing the US government to say that those patents need to be released to centers that can produce them in other parts of the world, in particularly in Senegal and in South Africa, and in other centers that have the production capability. And so we've been advocating for that very strongly, and that has an important ability on the issue of vaccine access and equity, which is dramatically unequal and unfair. And this pandemic has really shone a very stark light in how high-income countries have not been sharing the vaccine. So it's not only sharing the actual vaccines themselves, but also sharing the production capability through the sharing of intellectual property. The second part of that is to strengthen the World Health Organization, which is grossly underfunded and needs to be reformed for all the wonderful people at the WHO to be able to do their work. So there's structural governance issues that have to be dealt with. There's funding that has to be restructured. So as an example, if you were the Director General of the WHO, only a minority of your budget you're in control over. The rest is actually given by the donor countries and allocated with an intention to do what those donor countries want to do, not what the WHO has to do on the basis of what the world has asked them to do. It's a terrible situation. And then finally, we know that in order to be able to prevent, detect, and respond to pandemics, we've been advocating for the strengthening of the global health security agenda. That agenda of 93 countries have a map of where the gaps are. So we've been advocating for those to be filled. And we also have a capacity building subcommittee that works on aligning the training needs of low and middle income countries with trainers. So right now, we have a site called CUGHcapacitybuilding.org that we created. And that site is intended for institutions to share their training needs and institutions that have trainers, and it's a mechanism for them to match. So we're trying to match training needs with training capabilities. We have a lot of educational products on our website. They're all open access, and our committees try to identify those products that can be useful. The final point on the pandemic, and it's got to do with disinformation. So we have worked with, and you can look at our website, we've run webinars to showcase countries that have done a good job on the pandemic response. Taiwan, Hong Kong, and South Korea did a great job. We showcased that early on in the pandemic. We've also done sessions with a group called First Draft News. First Draft News, look them up. They've created a number of products that help people to deal with disinformation. How do you respond to disinformation? How do you deal with people who are driving disinformation out? So we've been working against the disinformation and the anti-science movement that has poisoned the ability of countries to be able to get their countries vaccinated, and are really poisoning the public in their knowledge of what needs to be done to address the pandemic. So those are some of the things we've been doing, Professor De Silva.
Yes, of course. Então, é interessante que vocês acessem o site, né, do Consórcio de Universidades para a Saúde Global, para acompanhar, inclusive, as atividades que têm sido feitas, né, para estreitar esse conhecimento que é produzido na academia, né, e que tenhamos, então, né, o alcance dos objetivos do desenvolvimento sustentável para o bem-estar, né, da sociedade. I have here one more question from Anselmo Cordeiro. How does the professor evaluate the health promotion university movement as a movement to achieve a better quality of life inside or outside the university?
Well, obrigado for your question. I think that academia doesn't do a good job. We do a fair job, but there's so much more to be done. And I think part of the challenge is that there's deep reluctance on the part of academics to become public academics, to assert publicly in the public, in the media, with governments, with the public, to what needs to be done to improve people's well-being. Now, there's public health institutions that do a great job, like CDC Africa, like ASPHER in Europe, like the CDC here in the United States. They send out a lot of information, but academia doesn't. We're still in silos. And part of the reason, I think, is that academics are not incentivized to actually do this work. And in fact, they can be marked down. There is a great, sad, I think, belief in many quarters of academia that it's not our role in academia to be involved in being so-called political, to be able to drive policies forward, to engage the public. The role historically, of course, is to teach and to produce research. But what good is research if it just sits in a document, right? If it just sits in a book or in a journal, what use is of it if it sits here and is never being used? That's a waste of incredible talent, resources, skills, and knowledge. And so our goal needs to be to change that. We have to reform academia. Academics need to be, and I think the way to do it is to create the financial incentives, the incentives in terms of tenure track. If you want to be a tenured professor, you need to be rewarded for being a public intellectual, for engaging policymakers. Do you build partnerships? Are you in the media? Are you educating the public? Right now, in many academic institutions, you're not only not rewarded for it, but you can be penalized for doing that. That is a colossal waste. That the world does not need that. That is a reform that we need to do, and that's a reform that any institution can do. And I would also just plead to those who are funders, you can put your money behind this. If you put your money behind this, that's probably the quickest and fastest way to reform academia. And in doing so, you'll be able to liberate the talent, the knowledge, the research, and the training that exists within academia and make it far more impactful on the global challenges we are facing. Obrigado, Professor de Silva, and thank you, Hannah.
Yes, então, né, muito ainda precisa ser feito, né, Anselmo, respondendo a sua pergunta aqui numa breve síntese, né, a boa pesquisa, né, ela precisa ser usada, né, mais uma vez enfatizando a necessidade de translação, de devolução para a sociedade desse conhecimento que é produzido no ambiente acadêmico, né, e ele coloca que os acadêmicos, em geral, eles não são incentivados a fazer esse trabalho, né, e que uma das possibilidades, né, e ele até no final da fala, ele trouxe essa questão da possibilidade de parcerias, né, entre a academia e a indústria, por exemplo, né, para avanço, né, nessa translação do conhecimento no sentido de incentivar a produção, né, de tecnologias, inovação, transferência do conhecimento, enfim. Thank you very much. Let me see. Hannah, I don't know if there is another question. Hannah, temos outra pergunta ou não? Essa foi a última. Sem perguntas, ok. And so, Dr. Keefe, I tried to do my best here because my English is not very good, but
you did a great job. You did a great job, and your English is 1,000 times better than my Portuguese. So, obrigado. Thank you so much for doing that.
So thank you very much. Eu gostaria de agradecer também à organização do evento pelo convite e pela oportunidade, e agradecer a paciência da plateia, né? E eu espero que eu tenha conseguido aí alcançar também, né, essa função aqui como moderadora. Preciso informar que haverá a mesa redonda 5. Ok, Hannah, mais algum informe? Dr. Keefe, it was a pleasure, and so bye-bye.
Well, thank you, Miranda. Very nice to meet
you here.
And thanks to everybody. We'll be in touch, and thanks to Hannah for advancing the slides, and for all of you for inviting me. I'm very grateful. Thank you so much.
Thank you. Obrigada, Hannah.
Obrigado.